My name is David Shaw, and I own a heating and air conditioning plumbing company. It's called Shaw's Incorporated.
I'm Clelia Garrity. I am clergy and on the staff of Christ Church, St. Michael's.
I'm Marcia Hall. I was a Rotarian in Frederick, Maryland, where we lived for 30 years.
I'm Debbie Collison, and I work at the Chesapeake Bay Maritime Museum as membership manager.
I'm Bob Holden, and I spent 28 years in the Army, followed by 15 years on what I characterize as the Beltway.
I'm Mike Mabe. I've been in the Talbot County area for about 11 years now, moving here from Dallas, Texas.
On the 18th of August, Clelia came and gave us a program about the Bondo Project, and she presented a very compelling story or rendition of the need in Bondo, discussed with us her role as the medical director of the medical program, and to make a long story short, she really impressed us.
Actually, I've been working in Haiti since 1999. And all of my work there, in one way or another, has focused on the healthcare issues in Haiti because Haiti has no healthcare system. The government does not provide any sort of medical insurance or any real public hospital system. And the people in the rural communities, which are many, many people, end up with no healthcare at all. I was invited to join a specific partnership in a very, very rural, very poor community called Bondeau in southeast Haiti. And there were already 4 or 5 partners involved. They have built a school and a guest house where the priest in charge who lives on the property and visiting people could stay. And there's also a children's home for children who have been abandoned by their parents. And so I was invited to join. I went down and convened a community meeting of the community leaders. There were about 14 people. And after a couple of hours of discussing issues, various issues in the community, I asked them to prioritize what would be the first thing that you would like to see me try to help you with. And they all said healthcare. We need healthcare.
And several of us got together and said, hey, let's support this, and decided on a donation, which we then made and presented to Clelia at an event at Christ Church. Parallel with that, we also got together and said, hey, why don't we actually go?
I'm not sure exactly how it happened, but a couple of us, you know, were joking around with each other, just, you know, hey, let's go, you know what I mean? And then one guy said, well, I'm not going if you don't go, so now I have pressure on me. So I'm like, well, okay, you know, let's go.
I believe that Haiti is the poorest nation in the Western Hemisphere. So if we're going to do something to help somebody outside of the United States, outside of our immediate area, we might as well help people in the poorest nation in our part of the world.
Not to be too sentimental or hokey about it, but I do think working with people in other countries helps you understand your own better.
And just to be a part of that and to be able to help folks at such a ground level is, I think, going to be just extremely rewarding.
This is not the once and done kind of activity that some organizations participate in. Clelia is very insistent that this has sustainability, and I see this as an opportunity to continue to help the same community in the future with other projects. So I think we in St. Michael's Rotary would like to have the Bondeau Partnership and the work in Haiti be part of our organization going forward with additional projects down the road.